All right, so we're just going to jump into a review of sensory organs because I feel like they always pop up, like a couple questions on each HUSI. So, okay, this is just a diagram reviewing the ear. The most important parts I would make sure to know are definitely the malleus stapes and incus, as well as semicircular canals, the cochlea, and what they have to do with fluid balance, as well as vertigo and tinnitus and stuff like that. Eardrum, just remembering that the normal appearance of the eardrum is pearly gray. It shouldn't be red, inflamed, or hard, or any of those things. Okay. Um, all right. And then yeah, this is the vestibular nerve and the auditory nerve, which combine to create the vestibular cochlear nerve, which is like 8, I think, for cranial nerves. Okay. Oh, and also just knowing what constitutes the outer ear, middle ear, and inner ear, because we're going to talk about different types of hearing loss and which parts of the ear that includes. Okay. So hearing loss. Conductive is the outer and middle parts. So these right here up until the cochlea and semicircular canals. And it's usually like an obstruction, like impacted earwax. And so if that obstruction is removed, then that hearing loss, the conductive hearing loss, will be resolved. Not always though, if it's more towards the middle. Okay, sensorineural is inner ear problems with cranial nerve 8. Okay, so this is not just going to be fixed with like hearing aids or something like that, because it's something wrong with like the actual connection from the ear to the brain. So the brain's not able to process that sound. Presbycusis is hearing loss starting around age 50. You lose high pitches. And so I feel like this question always comes up. So remember, like how do you speak to somebody who's hearing impaired or older? Remember not to speak louder or like dumb it down, but speak in a lower pitch. Make sure your face is visible. You're not backlit by light so that your face is dark. Use a whiteboard, writing to communicate. Just sometimes like the problem isn't like, I don't know, they just need a different way of communicating. Okay, there's different tests for the ears. So we have the Rhine test, air and bone conduction. So we have the tuning fork and we put it on this part of the head as well as the top and see if they can hear the vibrations from the tuning fork. And then the Weber, oh, sorry. So Weber is the top of the head with the tuning fork. And the Rhine test is in the air. And then you hold the tuning fork close to the ear to see if they can hear those vibrations. Okay. Tinnitus is ringing. So caused by NSAID, basically overdose. So if you take too much aspirin and they're like complaining of tinnitus, then you know that they're having a like adverse reaction to too much aspirin. Vancomycin is ototoxic as well as the other mycin antibiotics, or some other disorder that causes tinnitus, sometimes with vertigo or Meniere's disease, which we'll talk about later. Okay. So otitis media, itis meaning inflammation of some sort, infection. Kids are more susceptible. They have a shorter eustachian tube, and it's straighter. Just as a reminder, when you're giving medication ear drops to kids, we pull it down and back to open up that eustachian tube and make it straighter. For adults, we pull it up and back. For adults, for that, I just think adults are taller, so we pull it up. Okay. Secondhand smoke really increases the risk for otitis media. And so we're always aware of that and asking, is there any smokers in your home, to see why they're getting so many ear infections. Meniere's disease is usually starts in one ear, but may later involve both. It's basically the accumulation of fluid. Smoking, infections, or a high salt diet may worsen the disease. So the symptoms include like vertigo, a spinning sensation, hearing loss, ear ringing, tinnitus, and ear pressure. This vertigo may cause severe nausea, and imbalance may become permanent. There's a higher risk for depression because of the life changes that are having to be made because of the Meniere's disease. The diagnosis of this is a glycerol test, and it's testing for osmotic changes in the ear. So fluid pressure changes or differences. A positive glycerol test means there's fluid in the ear, there's osmotic changes, it's reversible, diuretics may help get that fluid off, it's not Meniere's disease. Okay, negative with the glycerol test means there's an improvement in hearing when the test is administered. It means a positive for Meniere. So sort of flipped. Positive means you don't have it, negative means you do. Okay, treatments are being like keep in a dark room, quiet, decrease salt intake, benzodiazepines for anxiety, and prochlorperazine or Compro for nausea. Okay. Okay, this is a review of the eye. Make sure to understand the different parts of the eye. The retina is where you're going to see a lot of like it's like the best part of your vision, your eye. Optic nerve, there's like a blind spot right here, but this is where the signals are transmitted to the brain. Macula, I don't remember, there's cones and rods in the back here to help us see black and white in color. Okay. Different tests for the eyes. Perla, you're very familiar with this, as well as pupil size. If the pupils are blown, so really big and not reactive to light, it may indicate brain damage or brain death in severe cases. Constricted pupils may indicate drug use. So that's why I like the pinpoint pupils, like overdose on drugs. 6 cardinal gazes, testing cranial nerves 3, 4, and 6 when you take a pen and ask them to follow it in those different fields of vision in the 6 gazes. Snellen chart, this always finds a way into HESI's, but visual acuity. So if it said 30 over 20, what you see at 30 feet, the average person sees at 20. So that's how you interpret the fraction. 20 over 200 means you're legally blind. Okay, corneal light reflex. You shine the light at their nose, you're going to see a reflection in both pupils, unless there's one pupil that's off. Okay. Eye definitions, myopia means you're nearsighted. Nearsightedness needs concave lenses to correct. Hyperopia, farsighted convex lens to correct. Presbyopia, aging eye means they're farsighted. Astigmatism, they have an irregular corneal curve. Mydriasis, dilation. Meiosis, constriction. Nystagmus, repetitive, uncontrolled eye movement. Okay. Disorders, conjunctivitis, again with that itis, got an infection, pink eye. Make sure to instruct people not to wear contacts during an infection. Helps to use warm compresses so that the eye doesn't get glued shut with that goopy stuff. Instructing family members not to share towels during the period of infection, washing hands, stuff like that. Because this can spread pretty quickly, especially you rub eyes and then touch something. There it is. Cataracts, the lenses are opaque, it looks cloudy. There's a gray cover, or sorry, yeah, may happen with aging. Glaucoma is increased pressure. There's going to be a gray cover on the eye. Open is more common than closed. Open, there's not very much pain involved, a decreased trabecular network, and that's the trabecular network is in charge of fluid movement in the eye. And they get tunnel vision, so their periphery is a lot more limited. Closed, they have sudden severe pain. That's how you can tell the difference. So you want to teach patients to use their eye drops to prevent blindness. That's like the key teaching for people with glaucoma. Make sure to use your eye drops. Something to also pay attention to, a really common eye drop for glaucoma is timolol. LOL is that beta blocker. It is a non-selective beta blocker. So those people with COPD and asthma, it's a contraindication to take timolol. Because it can cause bronchoconstriction in the lungs. Okay. Retinopathy can happen with diabetes and hypertension, the 2 most common causes, because of the end organ damage to small vessels. Okay. So this is the leading cause of preventable blindness. And so the way you prevent it is by controlling diabetes and hypertension. Signs and symptoms include blurred vision, black floaters. There's an increased risk for retinal hemorrhage and macular swelling. Okay. And then retinal detachment. This is an emergency. It can be described as like curtain vision, lights flashing, rings of light. The person I think of, because I had this in my simulation, I can't remember if it's second or third. I think it was second. But there was a patient, he came in and he was smacked in the head with like a baseball or something. And then during the simulation, he started complaining that he was losing vision in his periphery. He was seeing rings of light. He felt like a curtain was closing over his eyes. I don't know what it was until after in debriefing when they told me that it was retinal detachment and that's an emergency, and that getting hit in the eye does not mean you're going to necessarily have eye trouble. And so a lot of times when you get questions about, oh, you have a patient who was smacked in the head or in the eye with a baseball, like what's the first thing that you do? And the first thing obviously is assessment. So you're going to assess their visual acuity, like how much of their vision has been lost, if any, okay, to indicate a deeper problem. Macular degeneration, it can be dry or wet. Wet is less common, more severe, okay? So it can cause blind spot in the center, blurry vision can also happen with aging as well as cataracts. Okay. Okay, so eye surgery. So post-operatively, wearing a patch is important to increase to allow the eye to heal. Metal shields are used during the night to avoid scratching, hitting, anything like that. You don't need to wear it all day, but metal shield is necessary at night on the operative site. You want to avoid doing things that can increase your intracranial pressure. So like bending over at the waist, like sleeping or like hanging upside down. I don't know why you do that, but anything that would increase your intracranial pressure, like exercising too much, lifting things heavy. So don't lift anything that's heavy. If giving multiple eye drops, just as a medication rule, ideally you want to wait about 5 to 10 minutes between each one, and as well as put pressure on the lacrimal sac as you apply the eye drop to avoid systemic absorption. I already talked about this point right here about timolol. Okay. And the place that you want to make sure the tip of the eyedropper does not touch the cornea, as well as you don't want to drop it right in the middle of the pupil. You want to aim for the sac right there. Okay. Okay, so this is just a good review. This is normal vision. Cataract just has that blur over everything. Myopia, so that's nearsightedness. So everything far is more out of focus. Macular degeneration, we have that hole in the middle of their visual field. Glaucoma, we're losing periphery. Diabetic retinopathy, we have black floaters. And then yeah, eye floaters, we have, there might be something in the eye. Retinitis pigmentosa, we didn't talk about that, and then total blindness. Okay, this is also like cataracts / glaucoma. Okay. All right, so practice questions. That was a really short review, but let's jump into it. Okay, so in preparation for cataract surgery, the nurse is administering prescribed eye drops, reviews the physician orders expecting which type of eye drops to be instilled. And then C is mydriatic medication, so something to dilate the eyes. Okay. And that's just so they can see like and operate within the eye. Okay. So early post-op period, client who had cataract extraction complaints of nausea and severe eye pain over the operative site. The initial nursing action is to call the physician. So the keys here, nausea and severe eye pain. So both of these, they're indicators of increased intraocular pressure and should be reported immediately. They've given you enough information in this question to prompt you to call the provider. There are no additional assessments you need to do to know that this is an emergency. Okay. Okay, so they're being discharged from ambulatory care unit following cataract removal. The nurse provides instructions regarding home care. Which of the following, if stated by the client, indicates an understanding of the instructions? So which one's correct? It's C, I will wear my eye shield at night and my glasses during the day. So yes, it's okay to wear your glasses during the day because you're not going to be wearing contacts, right? And then wearing eye shield at night to protect the eye. Taking aspirin if they have any discomfort. This is a blood thinner. We know that. We want to avoid those in the immediate post-op period of eye surgery. You want to sleep on the side that wasn't operated on to avoid injury. And then D, I will not lift anything if it weighs more than 10 pounds. The rule is 5 pounds. So 10 pounds is too heavy. Okay. So developing a teaching plan for a client with glaucoma, which of the following instructions will the nurse include in the plan of care? D, eye medications will need to be administered lifelong. Okay. So eye drops prevent blindness, glaucoma. Okay. Okay. Okay, so they arrive in the emergency room with a penetrating eye injury from wood chips while cutting wood. The nurse assesses the eye and notes a piece of wood protruding from the eye. What's the initial nursing action? So before we even go into the answers, if any answer talks about removing this piece as a nurse, you don't do it, okay? That goes for any penetrating object. You're not removing it. In case of further damage, it needs to be removed surgically, okay? Usually. Okay, so the answer is C. Like I said, initial, usually we're talking assessment. So we're going to perform visual acuity test. Assess first, unless it's an emergency, like a chemical injury, then you would like irrigate before assessing. If there's an obvious intervention you should be doing because of the information they've given you in the question. Okay. And that is it for